Utilizing primary care doctors. So, today we will talk about the reasons, the benefits, and the perks of utilizing your primary care doctors and physicians. Um, when to go to the primary care doctor, when to go to the ER, and when to go to like the walk-in clinic. Imagine that you have a primary care doctor that you utilize every time that you're sick. You routinely go for checkups. You've been with this doctor for several years now. Y'all have a good working relationship and bond together, which is really important when it comes to your healthcare. You wake up one morning not feeling well with flu like symptoms, kind of like how I'm sounding right now. I have a little bit of a head cold, not feeling very well. So you wake up and you call your primary care and you try to schedule an appointment to get that routine swab for like the COVID, flu, strep, especially when it's this time of the year. COVID and flu, strep, all those things are always going around. It's very common to see, higher patient rates at, the walk-in clinics and things like that this time of the year because your primary cares usually are so booked up due to everybody being so sick, especially, you know, at the holidays when you go to your family functions and everybody's kind of spreading the germs with each other. So, your primary care doctor is able to get you in that day. However, sometimes they are booked out for the day and you're not able to get in right away with everybody being so sick, like I was saying, around the holidays and flu season. Sometimes they're not always able to get you in right away, and sometimes you need to get in right away. Um, if it's not something that you need in right away for and it's something that they can schedule out a couple days, then that's great. Let them do that. However, if it's something that you're needing to go get swabbed for immediately, you need to go make sure that you're not contagious, you're not spreading the flu or COVID with nobody, then if your doctor is booked out for that day, they will recommend that you go to a walk-in clinic, the closest nearby walk-in clinic. So imagine that you get to that walk-in clinic and you notice that the lobby is completely full of patients. And you're told that there's a 2 and a 2.5 hour wait. You already don't feel good. The last thing you want to have to do is sit in this waiting room full of other sick people that you don't know what they have. You're spreading more germs, and you have to wait hours to see a doctor. And it's not your primary care doctor. You're really just trying to go to make sure you're not contagious and to get that common cold medicine that they can prescribe. The problem that we most commonly see when it comes to the wait times at the walk-in clinics is that most patients do not have primary care doctors, so they are utilizing walk-in clinics as primary care. The problem with that is that a walk-in clinic, providers and doctors rotate shifts. Different providers are there at different times, and sometimes even random providers pick up shifts at the walk-in clinics. So if you are utilizing the walk-in clinic as a primary care provider, you're seeing a different provider almost every time you go. To receive the best overall health, you should want to see a doctor, the same doctor every time, who is following your health with you, who can better help keep an eye on your health with you, and you have a better relationship with. That doctor knows your wants and your needs, maybe that you have more religious beliefs that you follow. That's extremely important in healthcare. The doctors and providers at the walk-in clinic are not going to know these kind of things. They're not going to have your full chart of all your medical history, all your medical issues, problems that you could have had, or, be more prone to. Typically, when you go to the walk-in clinic, if you are utilizing your primary care, like, we want you to, and we hope that you are, when you come, you have to tell us, like what kind of medication you're on. Are you diabetic, or, do you have existing blood pressure issues, those kind of things, because we don't know those. We don't see you on a routinely basis, so we don't know all those common things, especially if we don't have a chart on you already. You're having to fill in these gaps for us. And if you're utilizing that walk-in clinic and you're coming, multiple times a month, and it's a different provider every time, that every time you come you're having to re-explain all of this to every provider, and they're trying to gather all the pieces, and you might leave something out that you didn't last time, or something gets missaid or misspoken, or so many different hands and providers are in your care that if it's not for common cold rashes, um things like that, you typically want to go see your primary care for. Your primary care is better at providing more preventative care. So if they know that, you have a family history of, let's say cancer or something like that, then they know that, hey, we need to be making sure and checking into your health earlier and doing preventative measures to make sure that you're not showing any early symptoms or signs of like any cancerous cells in your body or anything like that. Um, just imagine, I have a seizure disorder. So I see my primary care. When I went to my primary care, I started having these seizures. I explained to her that I did have a family history of, family or with the family history of seizure disorder, and I was referred out to a neurologist. So your primary care is one that refers you to the specialist that you are needing that you're needing that care for. Your urgent care providers, they're not ones that typically are going to refer you to specialists. Um, Unless it's kind of like an orthopedic, you come with a broken arm, they can refer you out, but typically that's not who you go to for your referrals. Primarily, you need to be using your primary care for your referrals for your everyday health. If we could utilize and get more patients utilizing their primary care, then maybe we could cut back some of this time that we're seeing, in the waiting rooms at the walk-in clinics. Another thing I want to say real fast, real quick too, is a lot of your walk-in clinics, they're not equipped for like emergency life threatening situations. So most walk-in clinics typically have like an x-ray machine. They're able to give fluids, that kind of thing. However, they don't have any kind of antisepsis medication. They don't have the ability to run MRIs, that kind of thing, if it was needed right away. However, they can transfer you by ambulance to the emergency room where you can get that done. However, if we could get more people to acknowledge and understand, if you feel like you are having a life threatening situation, to utilize that ER more as well, that could help prevent and protect your health better as well, because you're going to be getting to that care that can provide the best care for you in a faster manner. Um, I do just want to say that and just add that as well, because if you could cut so much time out if you knew, hey, this is a life threatening situation, I need to go straight to the ER. Whereas if you're driving yourself to the walk in clinic and then we're having to call the ambulance for you, you could have already had an ambulance, called for you when you were at home or wherever you was, or had someone take you straight to the ER. You could already be receiving that better care. Um, so just knowing which providers and which doctors are equipped for which kind of medical situations is extremely important, and to help cut back that wait time when you go, because anytime you go to the doctor, you don't want to have to sit and wait for hours, even when you're like extremely sick in the moment, or if you're not extremely sick in the moment, it's just kind of follow up routine checkup work. You never want to have to sit and wait for a long period of time.